Hello, I'm Dr. Bandari. I'm just recording a video on what is schizophrenia. I'm a psychiatrist, and I commonly see people in my practice who suffer from this illness, and I felt it might be useful to the people if I explain this video as what is schizophrenia, the various myths about it. We need to clear them perhaps. Also, if the patients understand the illness, I presume it helps them. It also helps them to get relief from the symptoms better and understand why something's happening to them. So, what is schizophrenia? Uh, it's a mental disorder which affects your mind. So it affects your thinking, your feeling, and your behavior. It often starts between 15 to 35 years of age. Around 17 to 21 is a common age for it to begin, though it can become as late. It can start as late as 30, 31 as well. It can also affect people in older age groups like beyond 60 or 70, but we are talking about it's more likely to start between 15 and 35. The prevalence is about 1%, so the chance of having in a person is about 1 per 100 people. So if you see 100 people, chance is about 1 per 100. One thing we must clarify: schizophrenia is often um, taken to be something linked with violence, which is, I must clarify, people with schizophrenia are not often linked with violence. In fact, the rates of violence in people with schizophrenia are actually lower than the rates of violence in common people. Other thing which is a big misconception in schizophrenia: hospital admission is often not needed, and most people are able to benefit with some sort of medicines and psychological help. And most of the people, a large number of people with schizophrenia, are able to lead a quite a stable life, able to maintain their work and have relationships with the help of medicines or sometimes even without them. Why it is caused? There are a number of reasons for it. On one side, we have genes, which make somebody more prone to have schizophrenia. Also, during childbirth, if there's some brain damage, or somebody has been using drugs like crack or cocaine, well, more like crack rather, amphetamines, ecstasy, there is some link with that. There has been growing evidence now over the last few years that cannabis seems to at least trigger or perhaps even can cause um, the, the illness. Uh, Further research is still being done, but at least as of now, the research does point out that if you are heavy abuser of cannabis, then the chances of having schizophrenia are increased many times. What are symptoms of schizophrenia? What happens in schizophrenia? Two types of things happen. One we call as positive, other we call as negative. Positive things are things which are more outwardly. For example, hallucinations. The person often um, thinks that he can hear voices, he can hear people talking to him or talking about in the background. Classically, you often sees two or three people or many people telling wrong things about him. So he can't see these people, but he can hear people talking about him in the background. Rarely the people with schizophrenia can see strange things or smell strange things, but hearing voices is the most common problem. You cannot ever explain to a person who has schizophrenia that the things you're hearing are not real. To him, hearing voices is as real as hearing any other voice or a sound. He cannot distinguish between a real sound and a hallucinatory or hallucination voice. The other thing which is they have some odd or strange thoughts with them. So these are called delusions. So they have these firm, fixed beliefs which to the normal people seem quite absurd. For example, somebody fearing that he will die tomorrow, and you don't know why he thinks like this, but he very firmly believes in this thought that he will die tomorrow. Or among the most common thoughts are paranoid types. The person is afraid something wrong is going to happen to him or to somebody whom he cares about. He is often frightened of something or somebody. These delusions are further can be of various types. I told you one is a paranoid, which is the most common one. The other can be nihilistic type, in which the person thinks that he can't function, his body is not there, he's already dead, he can't feel his body, such things. Similarly, there can be rarely grandiose delusions, in which the person may start thinking that he is very powerful, or he has powers beyond a common man, such things. Other thing which is that the person, because he has such odd thinking, he not be able to think straight, he may not be able to concentrate, he may not be able to listen to people, because he is so much absorbed and so much worried about his own concerns. He just can't think straight. It's like if I were to worry that I'm going to die tomorrow, I'm so much anxious about this thing, I can't concentrate about what's coming on television or what anybody else is saying to me, because I'm so much worried about something which is otherwise so important to me, that tomorrow I'll die, something like that, or somebody's after me, somebody's coming to kill me, such things. The other thing which they have is they feel controlled. These voices sometimes they may ask them to do things. They may ask them to take a knife and stab themselves, or they may ask them for example, open a window. Or I had a patient who felt that voices was asking her to stand in front of the window naked. So these voices can indirectly control them, but sometimes they can directly control as well. In a sense, the person may feel his hands and legs are not in his control, and somebody or something is controlling his hands, as if some ghost has come inside him who is controlling his body. The other are the negative symptoms, which are more in relation to the person himself, which doesn't really affect others so much, but affect the person, the patient himself much more. These are more like having loss of interest in things, not doing things, apathy, meaning just sitting there doing nothing at all, having poor energy levels, feeling sad and not happy with anything, not bothered about cleaning or shaving or showering in the morning. Um, these people may feel quite uncomfortable with other people. They may not be able to socially link or relate with other people. Um, Now, these symptoms, not all the symptoms are present in everybody. There's a varying degree of symptoms that present in various people. Um, and because the negative symptoms are more difficult to recognize, all you're seeing is this patient is not really talking to you so much for so many months now. It's difficult to recognize as against somebody who's shouting and screaming because he's hearing voices. So, because negative symptoms are more difficult to recognize, many people with negative symptoms may continue to have the symptoms before anybody else recognizes that they are not exactly right. Yes, treatment can surely help you, and there's good amount of evidence that earlier you give treatment to the patients, the better the outlook. Um, Among treatment, we have various medications called antipsychotic medications, which affect both the positive and the negative symptoms. They help the person understand, to clear up their mind, get their mind away from these odd thoughts and odd beliefs and odd perceptions like hallucinations. Uh, they are often effective in about 70 to 80% people, and if one medicine is not effective, you can try some other medicine. These medicines are a bit like taking medicines for hypertension. You have to take the medicine to keep the blood pressure in control. Similarly, you have to take regularly the antipsychotic medication to things in control. Patients often ask me how long they have to take the medicine. The answer is they may have to take it for quite a few months, perhaps even years. Once they are stable, once they get rid of these voices, once they get rid of these odd thoughts for many, many months, perhaps a stable period of about 2 years, then perhaps they can come off the medicine. Many people try to stop the medicine in between, or just so that they don't want to take medicines and want to get off the medicines. It is not a good idea because the chances of reoccurrence of schizophrenia or these hallucinations and or thoughts are quite high in people who stop the medicines. I will again say it is perfectly reasonably possible for a person to live a good functional life, maintain his work and relationships on medicines. Besides medicine, we have talking therapies or psychological therapies, most important being the cognitive behavior therapy, also called as CBT, which helps you to deal with these voices and how to live with them. Also, things like counseling and family therapy can be quite useful. Further, in some countries, there are supports like social daycare centers where people can go, where they offer classes to people how to deal with these odd ideas, how to manage with them. There also are work projects which help the person gradually get the energy back and the skills back to go back to work. Then, for example, some people may like to paint and draw to get their inbuilt frustrations or energies out. Further, special accommodations can be there where there's a warden there or somebody there who's there for support if these people need support. Many countries have community mental health teams which have key workers or community psychiatric nurses who visit them and help the people deal with their problems and help them take medications. Further, therapists called occupational therapists help you to to develop your skills for living and working and socializing. For example, an occupational therapist may help you regain your skills to cook for yourself or things like these. Further, there are various self-help resources available. These books or online things like the present one help to recognize your signs to get better soon. Also, uh, these self-help books or resources will help you how to feel less anxious. Uh, Also, in terms of self-help, it's important that you have one person like your partner or somebody who you trust very well, who can help you when you become well now. But if you were becoming unwell, before you become fully unwell, this person can help you recognize those signs of that you are going towards illness again, help you catch you before you become fully unwell, and make you aware that you are unwell. I told you before, stress is a thing which often leads to relapse, symptoms coming back. In people who have schizophrenia, therefore, one should try to avoid stress, one should try to avoid alcohol and drugs, especially excessive alcohol, especially. Uh, Obviously, try to eat healthy, try to not smoke, and physical exercise, keeping fit goes a long way. One small note about people who look after people who have schizophrenia: it's often difficult for the partners or people looking after schizophrenia to understand what's wrong with my husband or with my wife, because they can't understand why somebody is so much worried about thing which to them is obviously not present there. So, but the person you know may start behaving differently, may start avoiding people, become less active. He may not shave, he may not take a bath in the morning, he may have odd thoughts bothering him, he may be hearing voices, he may not be able to concentrate, he may not listen to you, rather he spends most of his time listening to his voices. It's very important not to blame somebody who has schizophrenia. Schizophrenia is an illness, just like you can have common flu or common cold. Similarly, somebody can have schizophrenia. It is not caused by a person, it's a chemical imbalance in the brain, and perhaps we should understand this thing and not blame somebody for the illness and for things they're doing. A person with schizophrenia is often quite sensitive to stress, so it's often useful not to shout at them, to avoid arguments, because if you stress them up more, they'll have further more symptoms and they will become more unwell. So, at the very last, remember, schizophrenia is a treatable illness, and a large number of patients are able to lead a normal life with help and support from their partners and people around them, and with professional help, like for example from nurses and from doctors. Thank you.